Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Good morning, Dr. Mencia.
Good morning, Anita. What a wonderful sunrise.
Yes, Dr. Mencia.
Gotta love Florida.
Don't we all? Let's play footsies.
Oh, tickly.
Well, feet are interesting because it's something we hide in our shoes, and it's not something that people use very often for sex that I know of, but maybe they do.
Oh, they do.
Oh, see, I know you're going to teach me about this.
Oh, that's another program.
Another program. Okay, we'll get another program. But I was curious about feet. Well, there are people who can't walk. They sit around a lot. And there are people who walk and they limp. And I'm just curious
that's
what
why I'm talking. Just tickle my feet there a little bit.
Tickle my feet. I can't concentrate if you do that. Let's talk about feet, and as a physician, what you think about feet and legs, and is this a way that you can tell if you're healthy, if you're not healthy? I mean, you just told me something very funny. I just have to repeat this. He was telling me that if you're having circulation problems, men who have, of course, hair in their legs because they don't shave, most men don't, the hair falls off.
Yeah, we wax. We don't shave.
What?
We wax. We don't shave.
I see. We wax. We don't
we
shave.
wax. We
What?
wax the hair off.
Wax.
It. Yeah,
You
we wax.
do wax?
No,
I didn't
I'm just
know.
kidding.
No. That's
I
right.
leave my
Those
hair
are the
on. They are
performers.
sexy, yeah.
Performers wax.
Yeah, when I put on my tan, you want to see the hair.
That's true. That's true.
The hair floating.
Well,
all
some
over.
men don't have hair in their legs, though. Do you know that?
Some men, right? Genetically they are hairless, and but usually, you're right. Women tend to shave, and men don't, or wax, or what have you. They remove the hair one way or the other. And because we do neither, if we have circulation problem, one of the first signs that you're gonna notice is that you're losing the hair on your legs, especially on the lower part of your leg and your feet. So when you notice the hair are coming off, you need to have your circulation checked. In women, when they shave, what they will notice is that they don't have as much hair to shave off as they used to have, let's say, 5 years back. So when you see the number of hair that you are having decreasing in quantity, it's not because it's not a sign of aging. It's basically a problem with circulation. And it should be checked because one of the conditions that we don't pay too much attention to, spider veins and varicose veins. So spider veins are tiny little veins that come together by the skin. And sometimes it's an artery that fuse with a vein. And because the artery has a lot more pressure than the vein, then the circulation toward that little vein on the skin, and it looks ugly. People come and they ask me to inject their spider veins so they can get rid of them. And usually what we do, we look for the artery that is feeding those veins and put a concentrated salt, 23% saline, concentrated salt, and shut them down. Now, Dr. Mai, one of my vascular invasive radiologists that work with us at the center, what he does, he goes much deeper than that. He goes for the veins that are deep into your legs that you don't even see. So sometimes you have insufficiency of the vein that are not superficial, that you can know, you rub your leg and they look fine. But when we do the ultrasound of the leg, we notice that you have varicose vein deep inside.
These are not the bulging veins.
Those are bulging veins, but they are so deep inside that nobody can see it. The doctor cannot see them.
Does
you
it
cannot
hurt?
see them. That's the big question. And how do you suspect that you have that? How would you ask for an ultrasound to look for venous insufficiency? Your leg tend to feel tired compared to what you used to feel with your leg before. So when you wake up in the morning, your leg feels sort of heavy. When you try to walk, you cannot walk at the speed you used to walk before. And it is not because the joints, it's not arthritis. A lot of times we tend to blame the joint and say, oh, maybe I'm having more arthritis. It's very different. It's not a joint pain that you are feeling, it's a muscle ache. You get a muscle ache. You are sitting for a long period of time, and then you get up and you try to walk, and you feel that muscle ache on your thigh and your calf. And a lot of times the cause of that is venous insufficiency. And one test that you can do is if you have support stacking, and even we have men that wear support stacking prophylactically because they have a very strong family history of venous insufficiency. You get a lot of the football player because they demand so much of their legs when they are in a game that they will wear support stacking underneath their clothes to try to maintain the return of that blood to the lungs and to the heart.
So that's what support stockings do?
That's what they do. They are there to, they can be used, and a lot of people want to wait until something is really bad to use them, but they can be used as prevention. You can use support stacking as prevention. And for those of us that do come to my center, when you walk into my office in Fort Lauderdale, if you look to your right once you enter the waiting room, we have in display some of the support stacking that we have, and they are very beautiful designed. They have different colors. They are pink and black and blue.
Really?
Nice design. We have support stacking that go right from the ankle to below the knee, where, support stacking, the old-fashioned support stacking, will leave your toes outside, and then will cover all the way to the below the knee or to the thigh. So now we have different type of support stacking. So I was talking to a friend of mine, a good friend of mine, who is also my patient, and she's traveling to Europe. And we were talking about support stacking to prevent clot formation. And she didn't have to buy the stacking. She had them at home. But she know we are open today. So if she don't find her, she's going to come back. I told her, get a support stacking that go from above the ankle to below the knee. Because those are good for traveling, to give you support on the calf. And they are excellent to prevent clot formation. If you notice when you go to the hospital and you're going to be laying down in bed, they put a support stacking to help you prevent clot from forming.
All right, so let me ask you, maybe I should use them. I'm standing at my computer a lot. Would that help me? Is that good for me to have
and you
those?
Know how, yes, and you know how you're going to notice?
How?
If you put them on, you're going to feel the difference of how your feet and your legs are talking to you. So when you have them on and you say, okay, let me try this on, and you start walking and what have you, say, I don't feel tiredness on my leg. I don't, this symptom went away, that symptom that you were not associating to insufficiency of the vein.
I'm going to do it, but the other nice thing is I've worn them before where they're totally go up your thigh. This way, it should be easier to just put it right on,
exactly,
isn't it?
Yes. And that's another thing. When you get those support stacking that you buy through the internet, they don't know how much pressure you need. When you get it from a doctor, the doctor will say, okay, we're doing this prophylactically, which means that you don't have severe disease, you have a mild insufficiency of the vein. So because we're doing this prophylactically, we're going to do mild support stacking, mild pressure. Some of them that are for people with lymphedema, they have so much pressure that a normal person will put them on and they won't tolerate it. They won't tolerate that because it's a lot of squeezing going on those legs. So it have to be comfortable for you, but it cannot be a stocking that is falling off. It have to be some sort of pressure going on. And it might sound that you're spending a lot of money, but the best way to do it is to graduate, to go with mild, to moderate, to more advanced pressure. When you do that, you are milking the fluid that is accumulating on your thigh and your calf to get that fluid moving.
Well,
And if you are traveling, you don't need that pressure so strong in your thigh.
So let's go back to the footsies now here. So now when someone comes in with feet, are they going to complain that their feet hurt? I know you have a wonderful podiatrist there.
We have 2 podiatrists. We even have one that will do the home visits. But
that's
with regard to the feet, I always like to see the genesis. When I wrote the book, when you read the book on the kidneys, the first thing I talk about the genesis. How did the kidney were formed? What kind of tissue come together to form the kidneys? Well, it's interesting when it comes to our extremity, the lower extremities, when the human body is being formed, you have no legs. You have
really?
You have no legs. And then as the body starts forming, as a matter of fact, your belly, when the body is forming, your belly is wide open. All the intestines are out, and the belly is wide open. And then things start sort of coming together. And when the extremities start coming out, the first thing you get is the little finger. So the little finger start coming out, and then the start lengthening into a foot, and then a thigh, and a knee, and so on. And then it lengthened into what we recognize today. So it's interesting to know that in the genesis of a human being, the feet don't come first, but they are the pillars that hold our body. So maybe because of that they don't come first, we tend to neglect them.
Ah, that's a good supposition.
We tend to neglect something that is so important for us to remain erect and to function. When they don't function, then we depend on a wheelchair. We depend on a cane or a walker. And it's interesting to see people that come to my office and I say, we have a podiatrist. They can look at your feet. Oh no, I get my manicure. I'll say
not the same.
It's not the same. It's getting a manicure and getting a doctor to look at your feet. It's quite different. And I see my podiatrist. I see, my podiatrist because I have a little callus that developed in one of my little toes. And I watch her. I'm a doctor. I'm a teacher. And I'm a student. In order to teach, you have to be learning all the time. So I'm always observing, looking for things to learn. And I watch her when she's doing my feet, Dr. Joseph. The first thing she does, she inspect and look for my hair. Are my hair there? Or are they falling off?
Really?
And it's like a reflex. You can see she does this like a reflex. She just, it's her way of examining my feet. Then she go and take my pulses. And she check my pulses. Then she go and check my nail. And then she go and take care of my callus. And she look for other calluses, if anything else is going on. And she talk about my footwear, make sure I'm not walking barefooted, and I'm taking care of my feet. And it's one tiny little callus that she can just go straight to the callus, shave it off, and send me off on my way. But she go to this process. And I have a lady who does my nails and take care of my cuticle and all that stuff. And she put the moisturizer, and she put my feet in water, all of that stuff. I do that also. But I see my podiatrist because it's not the same. And it's covered by my insurance. And why not?
I love this idea. So people who come to see you for something else, you probably direct them to go see the podiatrist as part of the comprehensive
exactly.
treatment.
Especially the people that should always be seeing a podiatrist. If you know that you have a a touch of diabetes, quote unquote, a little touch of diabetes, your sugar tend to go up. Or if you are a full-blown diabetic. If you know to have venous insufficiency, or you've been told that you have PAD, peripheral arterial disease, mean that your arteries are closing down with plaques, those people should go ahead and see a podiatrist, because the podiatrist will be able to pick up damages to your feet way before. And I have a couple of mine. They spend time here and they spend time on the Keys. And one of them, he's diabetic. And he's obese and diabetic. And he get this little ulcer on his big toes. And his partner is so diligent. They are both so diligent. They see the little ulcer coming out. They run to my office. And they usually come on Saturday. They like the Saturday hour. They run to my office and say, Dr. Mencia, look at my toe. And we take those little ulcers and we inject it with antibiotic and we keep the pressure off from the area. And we have cured the ulcer several times already.
Because if you don't, what would happen?
If you don't, that ulcer will continue to dig deeper into the tissue and it will hit the bone. Once it hit the bone, now it's osteomyelitis, infection of the bone. Osteomyelitis, the treatment is going to be at least 6 months of antibiotic. Sometimes you have to be hospitalized. If the osteomyelitis is so advanced that the area starts turning black means dead skin. So if you start having necrosis or dead skin in the tip of any of your digits, your toes, we have to amputate. So it can be serious, and this comes from diabetes, it comes from peripheral vascular disease. My dear patient, my good friend of mine too, he knows he has the venous insufficiency. He already went to the vein doctor to get that taken care of. He has leg edema, he has the diabetes, he has the peripheral arterial disease. He has all this condition, but he doesn't throw the towel. He keeps fighting. He's a fighter. And when he sees something, he's not afraid to run to my office and say, check it and treat it quickly. And we jump on it. And so we need our podiatrist. And if you have diabetes, especially if you have full-blown diabetes, I like my patient to see the podiatrist at least every 3 months. 3 to 6 months, no more than 6 months. And as needed. So when you see something coming up that don't feel right, then run to the podiatrist and have them take a look.
And so people who have fungus in their toes, and so many people, it seems like this is very common, a podiatrist would help that before it happens. And what does she do if it's already that way?
Well, if it's already there, there are treatment. Usually we shave the nail that is affected. We shave it down so that the medication that we drop on top of the nail can penetrate. The nail, the structure of the nail can be very tough. So it's very hard for medication to get in there. So we tend to clean underneath the nail, and then we shave the top, and then we put the medication. And you have to continue. That's a good point, because the medication that treat the fungal infection tend to go deep into whatever tissue you have affected. So a lot of time when you have a fungal infection and you start putting this Penlac or any of the product that we have for the nail, and we see the nail start getting better, we have the tendency of stop the treatment. So it's already getting better. I don't need anything. Let the body heal itself. Well, what happened? The fungal is deep into the tissue. So you you kill the one on top, but you kill the front line of the enemy, but you left everybody else behind. So the people behind, what they're going to do now, they're going to regroup and come forward with more strength. And now they're going to recognize that you're going to put this little Penlac that won't be effective. It's called building resistance. So you want to continue the treatment even though it's getting better until it's completely gone, and a little bit longer. I tell my patient a few weeks more, even though the nail looks normal, just treat a few weeks more so you can eradicate the fungus.
I think this is a very important discussion because it seems that fungus and nails, we even see advertising on it. But I want to just tell everybody, if you've not listened to the show before, you wonder who this magnificent physician is, well, I'm going to tell you. He's Dr. Andy Mencia. He is a geriatric physician, which is not common here, even though there should be a lot more of them. Dr. Mencia, many years ago, started the medical, it actually used to be called the Adult and Geriatric Institute, but we shortened the name. It's now AGI Medical and Dental Centers because they have full-blown dentists. And I want to tell you, he has 2 offices now. Started off with Commercial Boulevard. He has that, of course, in Fort Lauderdale. And now he's at Boynton Beach, and he was just there last week, which was very exciting. So if you would like to have a very, very fine physician take care of you, I'm glad you're listening to the show. The phone number to call to make an appointment is 954-489-1345. Again, 954-489-1345. If you're in the Boynton Beach area and you also want to have the same care, the phone number there is 561-270-6494. And as Dr. Mencia has been telling throughout his speaking, he does home visits, and they're very popular, and this is for homebound patients. These are people who it's just so difficult to get to the doctor. They are open on Saturdays. That's where Dr. Mencia races from this radio show down to his Commercial Boulevard office. The website is agifl.com. AGI, standing for Adult Geriatric Institute, agifl.com. And Dr. Mencia has this wonderful, wonderful World of Wellness, which we do every Saturday. You can read his articles in Boomer Times, and the new one has just come out. And if you want to pick up Boomer Times, you can go there because Dr. Mencia does have them to pass out. So, Dr. Mencia,
they can take it with them.
Yeah, they can take it. That's true. But Dr. Mencia, this is the interesting thing about people here with their feet. You notice a lot of people wear these flip-flops.
Yes.
And I know you've told me they are dangerous.
They can be very dangerous. The footwear, even if you get a lot of people that have good sneakers, but they are too old, and they need to footwear. We need to we need to change them. I have several pair of shoes, and I make sure I rotate them. And on the weekend, my weekend footwear, I rotate them.
Why do you do that?
Because if your weight distribution changes with time. So if you wear the same shoes as your weight distribution changes, let's say go from my heel toward my small toes, and I'm developing the little callus I told you. So if I wear the same footwear, then my footwear will adjust to that weight distribution. All the other shoes will feel abnormal. So if you rotate, number one, you are helping with the cushion of the shoes that you move now. You move to a different sneaker or different footwear. When you rotate them, then you will allow then your feet to always have a good cushion when you walk on them, and that will help you prevent calluses, and will your feet can affect your back, because when the weight distribution switches, sometimes what we have to do is then depend on the back and you are very unconscious of it. Your back then start giving support to try to maintain your balance with your new weight distribution. So
it's a complicated subject, Dr.
It's
Mencia,
a very complicated subject.
I was thinking about...
and I have a thing, we have this private home health care called Caring Hands that just got organized, and I've been trying to help them get, flourish in the field of geriatric medicine. I have Linda Hughes, who is an invasive radiologist who I work with very closely
I
when
love
I
her.
need. I love her. She's excellent. I have Dr. Mai that works at my office and does the veins. So I have this whole team. I have 2 podiatrists. So we have this whole team that work together. I don't have the manicure and pedicure yet, with
you have the
with
other.
the different nail colors, but we will get there.
Okay, and we're going to have to say goodbye to you, as we hate to do, but please do go to see Dr. Mencia if you have anything for your physical and your mental health. He is so spiritual. It's such a beautiful thing when he leaves the radio station. We're all on a high. Thank you, Dr. Mencia. As usual, you're just great.
Thank you, Anita.
Thank you. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.